Meningitis, encephalitis, and sepsis are a leading cause of acquired brain injury and are all an expression of the body's response to an infection. In the case of meningitis, which is one of the leading killers of young people and kids who are in a communal kind of environment, it is an inflammation of the meninges, which cover the brain, and they become inflamed and increase pressure on the brain, increase intracranial pressure. It can be insidious. At first may look like something else, although in some cases you may see neurological symptoms before you're even aware that they're sick. Confusion, disorientation. You may see a fever if it's bacterial in nature, but you also may see a rash. It is important to be aware and to make sure that your children are vaccinated against meningitis, because it can cause permanent neurological impairment, including behavioral and personality changes, cognitive changes, and it can also cause limb loss. It can cause damage to other organs with permanent effects. Encephalitis is inflammation of brain tissue itself, an attack against the brain. There are a variety of different organisms that can cause this. Some are borne by mosquitoes, so zoonoses, zoonotic origin for these conditions. And so again, it's important to make sure that you protect yourself when you go outside. It's important you get vaccinated against these types of organisms, and keep an eye on the CDC tracking for these specific disorders. It is important to seek medical attention if you or a loved one is starting to show unusual neurological behavioral signs that are sudden onset. Anytime something like this would appear, but these conditions are, while rare, are likely to leave when permanent deficits. So that's important. And sepsis can onset from any significant bodily infection that is left untreated, whether it's a thermal infection, whether it's a UTI, which is very common, and women are more vulnerable to this, so it is important that to get UTIs treated and taken care of. Again, these may onset with mental symptoms first, including vivid hallucinations and perceptual disorientation, aggression. So again, seek medical attention for any kind of neurological change, because this is likely to leave one with permanent deficits. And it's also important to remember that those of us with traumatic brain injury are more vulnerable to sepsis. 1 in 3 people with traumatic brain injury will get sepsis at some point in their lifetime. This seems to be related to changes in the immune system due to altered signaling between the brain and the immune system.